Good morning, good morning, good morning. Hey, like my hat? USA. Kind of like that hat. USA, kind of like the USA. Listen, this might be a little controversial, but it's not meant to be. Just maybe a different perspective. And I know, first, let me just preface, I'm actually at a hospital right now at an undisclosed location. If you know where my wife works, then you know that's where I'm at. And my wife's here having a procedure, kind of the procedures we have when you're in your later 40s. I'm scheduled to get one, in probably a couple of months. But I was inside and I'm not used to having a mask on, so I actually had to come outside and get some fresh air. And I wanted to share with you about healthcare. Thinking about healthcare, what a beautiful place too. You probably know if you've been here. You probably know where this is right now. Maybe you even work here. Maybe you live nearby. Maybe you've been to this place, location. Hopefully everything is okay. But I'm going to sit down. It's actually nice and quiet here. I don't have to have a mask on. So we're going to talk about less access to healthcare and why that could be potentially exactly what you need. So first, I have to tell you, I've been in healthcare. I've worked in healthcare. I worked in a hospital. My wife has worked in healthcare for over 25 years. We both are a byproduct of that as far as our profession goes. So I have a little bit of experience. Not a tons of experience, not nearly like my wife does working in a private practice. She worked in women's health and family medicine. I'm very proud of her. And now she works in GI at this very hospital here. So as she's in there getting a procedure, it's pretty cool. Technology is awesome. They're going to let me know via text what's going on and how long. It's about a 2-hour, give or take 2-hour procedure. But as I was thinking of this, and I was like, you know what? I was thinking to myself, and I know this actually hospital, not here in this location, but this hospital, it's gotten a little bit of this becoming a little notorious, and it's very well known. But anyway, I'm not here to bash the hospital because I think the hospitals are great. I think medicine can be very, very helpful. Doctors are super important. Even nurse practitioners are very, very important as well. But I wanted to touch base on access to healthcare, having less access. So, okay, having access, meaning, if you have something really wrong, to get it fixed and get it set up, right? When I worked in physical therapy, I remember one of the things that that encouraged me to go into physical therapy is I saw how lucrative it could be. And when I worked in it, I remember seeing how so many people really didn't need physical therapy that were still getting physical therapy. So this is way, way back, like when I did internships and so forth, so on. Even when I worked in the hospital, I saw for about 5 years, I saw a lot of patients that were receiving physical therapy services that really did not, if they were taking care of themselves, if they were taking care of their health, if they were doing what they were supposed to be doing preventatively, and even after, like post-surgically, post-operatively, what have you, is that they would not need physical therapy. But we as humans, we're flawed, right? We mess up, and myself included. So again, it's not me versus them. It's not people that go to doctors versus not. It's about just having a new perspective on medicine. And the way it seems to be going, at least right now, I have to show you this. If you're wondering what that noise is, it's that waterfall right there. Very, very beautiful waterfall. Really, really pretty. This is a beautiful campus here for sure. It's a little bit chilly out, but I'm glad I don't have to have a mask on. Maybe I need to put one on to stay warm. But here we are. I'm thinking of having less, think about this for a moment, having less access. So when I was going through the years working in physical therapy, working in hospitals, I remember what was happening. Healthcare system was changing at the time. As far as for physical therapists go, what that meant was, like, say you had a rotator. Let's just put it in practical perspective. When I started out way back in the 90s in physical therapy, if you had a rotator cuff tear, you essentially could go to a physical therapist and they could treat you for as long as it would take for you to get that rotator cuff repaired. In other words, if it took 2 years to fix your rotator cuff, you could essentially go to physical therapy for 2 years and the physical therapist would get paid by that person's insurance or privately, mostly insurance. But then what happened? We screwed the pooch, because what happened was therapists and even patients were taking advantage of the system, and the system kind of went bad. Now, again, I'm not here to go deep diving into all that, but I wanted to share with you when that changed. I remember even when I worked in the hospital, where patients used to be seen for hip replacements and knee replacements. And I worked at one of the top orthopedic hospitals in the country, and that's the Hospital for Special Surgery. Phenomenal. If I were to need a hip replacement, I'm getting older, if I were to need a knee replacement or a hip replacement, and I had the opportunity to get it done at the Hospital for Special Surgery, that's where I would go. But I do remember working under one of the very first physical therapists, when I believe it was called the Hospital for the Ruptured and Crippled. That's what it used to be called prior to that. And I remember like the length of stay for somebody in the hospital was like 2 weeks, 3 weeks, et cetera, et cetera. And then when I worked there, which was years later, this was in the 90s, it was like 3.6 days. In fact, they were very proud that it was less time spent in the hospital. So what does that have to do with less access? It's coming regardless if you want it or not. The reality is it's coming. Less access to doctors and nurses and medical and how things are covered nowadays is going to be less and less over time, which means is you're going to have to take more of an initiative, take more of the steps that you need. And unfortunately, it's like you're either going to or things are going to happen. Like I tell my kids, when you make choices, there's repercussions from the choices you make. There could be benefits, and then there could be repercussions. And unfortunately, if you make poor decisions, you're going to have to suffer the consequences. That's just inevitable. If you take poor care of your health, there's going to be repercussions. Now, of course, there's things, I understand, there's things like cancer and things that we don't have any control over, but there's a lot of preventable things that you see people on medication for and people having surgery for. And even one of the things that I've come across in last year, is a number of people who are actually having insurance companies pay for their weight loss surgery, right? And what was really interesting to me, it was kind of a double-edged sword, is the doctor who prescribed them all the medicine to go on to have the lower blood pressure and lower cholesterol and all the stuff and diabetes medicine. And none of that really, aside from managing it, it basically managed it, but like putting a Band-Aid over it. But the lifestyle had changed. The choices didn't change. The weight stayed on. The health issues continued to persist. And then that turned into more and more weight going on, where then the next specialist said, well, why don't we just have weight loss surgery? And because you're at a high risk, your insurance company is going to pay for that surgery. Do you see where that seems to kind of boggle my mind and seems to go wrong? I know there's lots of different reasons why people put weight on. And I'm not here to beat up all of the reasons why, but I'm here to just tell you that the reality is one of the best things that can happen, I think, in this country, in this world, is less access. Less access. Maybe this gets you upset, especially if you're a doctor and you believe in medicine. I believe in medicine too. My wife's in there she's having a procedure done, not surgery. She wanted me to make sure I was clear. We've been through 3 surgeries. She's had some major surgeries done, and I appreciate that. But I do know that why beautiful campuses like this and like where I used to work, beautiful waterfalls and beautiful buildings, multi-million dollar buildings. It's about making money. It's about business. It's about making money. And I'll tell you what, hospitals and doctors' offices, they make money. The bottom line is like anything. It's about big business. And unfortunately, sometimes that's at the cost of you and me. So my encouragement to you, and hey, I run a business. I'm a small business owner. I have coaching. Why do I talk about this? And why am I sharing this right now? Well, because as a coach, my job is to help people not need to be as much on medication, or even to prevent themselves from needing surgery, or even potentially prevent themselves from needing weight loss surgery, or even anything else, or being out of work, or being sick, or dying at a young age. When you are on a healthier path, right? And it can start today. The new year is here. USA, we still have some freedom. While you have freedom, right? When you're not maybe like forced to go to a doctor because you have issues, not forced to go on medication, not forced to have surgery. When you're forced to do things you don't want to. My wife and I were talking, we're kind of rebellious. And if you haven't known that about me, that's just who I am. I'm a little bit rebellious. I think it's just my parents taught me to have a mind of my own And as I share this, I know I might upset a few people, but it's not meant to. It's really just to encourage. This is an encouraging message to share with you that it will pay for you in the long run and even in the short run to take better care of your health, to make it a point to make your health one of the highest priorities in your life that you can ever do. Now is the time, better than ever. Even I think in the entire 20-something, 2.5 decades that I've been in this as a professional coach, as a trainer, having a gym, working in hospital settings, is you have an opportunity now to take the next step forward. Now, you can do it a number of different ways. You can just not do it. You can stay sitting on this bench. You can just be a visitor, Tuesday visitor. Hopefully that didn't say the name. It's okay. Tuesday visitor. You can just be a Tuesday visitor in your life. You could be a Wednesday. See, I'm a Tuesday visitor. You could be a Wednesday visitor. You can be a Thursday visitor. You can be a Friday visitor, or you can take action steps to not just be a visitor in your life, to take action to become part of your life, become part of the solution. Like, you have what it takes to become part of this solution of being a healthy human being. Does that make sense? I hope it does. I just want to encourage you. Now, don't get me wrong. I have a doctor's appointment my wife made for me. And I would say, knock on wood, I haven't needed. Now, I probably will need at some point something, somewhere, maybe a medication, maybe, my dad had quadruple bypass surgery and he did phenomenal. I'm very grateful for the doctors. My mom fell off a 10-foot ladder. She had major surgery on her leg. It threw our whole family back for years. And it was hard, but I'm very thankful for that. My son has had way more surgeries than you can even imagine. In fact, 1 year ago today, we were here because he tore his ACL. And I don't know if you recall, but I would say is thankfully the doctors that did surgery on it, they fixed him. Those are all things that I would say weren't preventable. They were accidents, right? There's things that happen in life that are accidents, but there's also things that happen because of the choices that you make. And my question to you is, if you're not making choices to take care of yourself and your health, what are you expecting to happen? You're expecting healthcare to take care of yourself? Are you expecting to basically be babied the rest of your life into needing medications and needing to go to doctor's visits? It kind of got on me. That's why I had to get outside here in the fresh air. As when I walked in, nobody said hello. Of course, we all masked on, but nobody said hello except for the people that work there that are getting paid to say hello. But I was in the elevators. Everybody just kind of and it's very sad. It's sad. So if you can avoid staying away from hospitals altogether and doctors' offices altogether, I'll tell you what, I'm for it. I know these geese that are coming in here, they're all for it. You hear them? They're making the noises. Anyway, that's all I have. I hope this put a little light into perspective of the reality. Maybe you've heard it from me. Moving into the next 4, 5, 10 years, you're going to find that it's going to be very, very valuable for you, for your health, for your loved ones, for generations to come. Think about this. Like, if you're not healthy right now, if you're overweight, if you're out of shape, if you're not taking good care of yourself, are you just expecting that your kids aren't going to follow that path? Are you expecting maybe the generations to come to maybe just kind of fall in lines? I know for a fact, just based on what I've seen in my family. Now, I don't know in your family. I know in my family, my kids didn't listen to a lot of things that I said, but they did observe what was happening in mom and dad's life over the course of the last 20, not 20, my son's 18, over the course of the last 18, 19 years, and my daughter 16 years. They saw mom and dad taking care of themselves. Was it perfect? No. And just because I'm a coach, my wife works full time. She gets up early and goes to the gym. My kids saw that. My kids saw that we were taking care of themselves. They also saw other parents, friends of theirs' parents, who weren't taking care of themselves. And I'll tell you what, they're very, very observant. Kids these days are way smarter than you think. Some of my kids are way smarter than me in some level. Not maybe as much wisdom, but way smarter. But I can tell you they've learned from what mom and dad are doing. And my question to you is, for the generations to come, what do you want to leave your legacy? You want to leave them a bunch of money, that's totally cool. But what about like their own personal health? Like, in a world that we live in now, that should be one of the things that's at the top of your priority list, is your personal health. taking care of your health. I'm not talking about being on more medications and taking more shots and doing all those things. Yes, some of those things can be helpful. I'm not saying that. But I'm saying is, what are you going to do yourself? What are you going to own up to yourself to take care of yourself and the ones you love? Take care. God bless. I got to get back inside. It's getting cold out here. Talk to you soon.